Thank you very much, Rahima. Thank you to all of you for staying and listening to all these amazing innovations that we're seeing being produced, some from our own continent here in Africa and some from outside our continent of Africa. Let me begin by inviting our panelists for this session on health. So in the last session, we heard that they said transport was the most important. Respectfully, I disagree. I think we need to be healthy first before we can travel. So health has got to be the one, and we have to ensure that everybody is healthy, because a healthy workforce is a healthy economy. We have to fix Africa's health systems. Let me invite them, the people who are going to be providing the answers. Let me invite Dr. Elvis Eze. He is a medical doctor. Sir, thank you. Come and share your ideas with us. We look forward to your practical advice. He has got experience in global health, understanding health systems, and providing technical support through his work at the Commonwealth Secretariat, among many other things. Let me also invite Dr. Ibrahima Khalilua Dia, Head of Digital Health Department, Minister of Health and Social Action in the government of Senegal. Dr. Ibrahima is a geographer of health, and he has an IUED in e-health, and is also a qualification in information system management, which includes health and geography. Thank you very much. Sir, moving on quickly, B.A. Hassano, Technical Officer, World Health Organization, Regional Office for Africa. He's got a very, very important task for us here today. He's going to paint a picture of where we are in terms of health on the continent, but importantly, he has brought with him all the way from the WHO the answers that we require to ensure that all those indicators that make Africa a bad place to be are corrected. And last but not least, I have Dr. Patrice Singer. He's a medical director, Babylon Health Rwanda, and as you can see, he's also a medical doctor. He has practiced in both public and private spaces, and again, he is part of our solution here today. So thank you very much for being with us here today. I am going to join them shortly, and then we are off and flying on our discussion today. So, I am going to surprise my panelists. I tell you the truth, I didn't tell them what I was going to do. I'm going to ask them questions. Let me start. Can I begin right on the left, Elvis?
Sure.
Can you tell me which is the world's fastest growing population? Where is it?
Africa.
Africa, he says. Sir, Patrick, I want to know where in the world you find the fastest growing cities.
Africa.
Africa. Do you know where the fastest growing economies in the world are? Can I ask you?
Ethiopia, no?
Which is Africa.
In Africa.
Which is in Africa. Excellent. And the world's largest youth population, sir?
Africa.
Africa, yes. All right. So you can see clearly these are all things that we know, and we do need to find solution for all of these things. But the answer to the question on the issue of the fastest growing city in Africa, it is a city called, I don't know if I'm going to pronounce it correctly, Buda in Cameroon.
In Cameroon.
7.8%. These are statistics that I got. So I think I'm just using those statistics to illustrate the scale of the challenge that we have, because all those people require health services, and we have to ensure that we are able to provide them. So how do we do it? Let's go where it all begins, at the World Health Organization. Knock, knock, sir. Are you there? Okay. So I want you to paint a picture for us in terms of just where we are. We know the indicators are bad. We know the statistics are bad. But very quickly, briefly, please help us understand.
Merci beaucoup, Godfrey. Le problème de la santé, c'est un problème très complexe. Je vais vous donner le contexte. Aujourd'hui, 9 décès sur 10 du malaria proviennent en Afrique. 9 décès sur 10 du sida
9 out of 10 from HIV.
Donc la charge de maladie c'est en Afrique.
So the disease burden is very heavy in Africa, but only 20% of the world's population consume 80% of health expenditure. 80% of the population of the world consume only 1% of health expenditure. In Africa, there are 2 medical doctors for 10,000 inhabitants. In Europe, there are 32 medical doctors for 10,000 inhabitants. In Europe, there are 79 nurses for 10,000 inhabitants. In Africa, there are 5 hospital beds for 10,000 inhabitants. In Europe, there are 63 beds for admission for 10,000 inhabitants. This is the backdrop against which we are living in Africa. Do you think that with this kind of landscape in 2030, we can reach out and achieve SDG 3? It would be quite challenging. This morning, we said that the UN forecast and projections show that in 2050, populations in cities will be twice what they are. In these populations, 60% will live in peri-urban areas, so there will be a problem of water, transport, education, health combined with the population. So that's the background. If we are told today that we need to increase the financial resources, we need to increase money. It's required, but it's not good enough, because if our states multiply by 3 the current budget, they won't be able to cope with the issue of health. Hence the idea of innovating. We need to increase our budget and innovate. I do hope that I'll have an opportunity to take you back to this issue of innovation. Thank you.
Thank you very much indeed.
Merci
You are going to get
beaucoup.
the opportunity, and you're also going to get an opportunity to tell us about what needs to be done, because you've already painted a very big picture. The budgets are not there. The amounts that we're talking about are incredible, but we need to find solutions. And solutions, here we come. Let me invite the contribution of Elvis, if I can. No, let's begin with Patrick first, and then we'll come to Elvis. Patrick, from your perspective, I mean, we heard in the last conversation how important technology is becoming as part of the solution. Please help us, if you can, to see if indeed technology will be able to help bridge the gap that we have. I think we forget. Many, for us who grew up in the 60s and the 70s, the government knew about us through the headman and sometimes a piece of paper. But with the coming of the mobile phone, the government at one go was able to find millions of people on the database that it probably didn't know existed. Is there a chance we could use technology in a similar way?
Thank you so much. And the answer is yes. My friend there has painted a very dark picture of our health status. And indeed it is dark, but I like to look at this as an opportunity rather than a challenge. What does the healthcare system of the future look like? Let me give you a scenario. You have a patient. The patient talks to his doctor on the phone before he goes to the hospital, because some of the issues he has can be dealt with over the phone. That patient is wearing a wearable device, and let's say there is an unfortunate event and then he collapses because he has a stroke. That wearable device is going to issue a signal, and an ambulance is going to be sent to his home. In the ambulance, the nurse will have access to his medical record online. And within the transport, a CT scan is going to be done. The blood clot is going to be diagnosed, and the patient will be expected at the hospital by the GP. When they get at the hospital, the GP will be able to use, let's say, a smart catheter to remove the clots, and the patient will only stay at the hospital for 2 days, because this patient can actually be monitored from home using some sort of command center. That is where we're going. That is the future of healthcare. The future of healthcare has to do with digital health. It has to do with innovation. It has to do with thinking outside the box. And I like the way the president of the Islamic Bank said it: think outside the box and actually throw away the box. It has to to do with technology. But then there are challenges, and I guess we'll be talking about this.
Absolutely, and one of those challenges has got to be around infrastructure. The infrastructure that's required to build the backbone that enables us to be able to do all the things that you need to do. Elvis, would you like to address that, please?
Yeah, thank you, Godfrey. I was just going to say, and I was listening to you, and you talked about the patient having a wearable device, getting on a CT scan, on the transport, and I think it's a brilliant solution, using digital health in that way. But a lot of the infrastructure that I think about when we talk about the challenges in Africa and challenges in terms of growing cities is actually in the simple things. And for me, listening to the presenter just before us on the toilet facility, the reduction in water need, and also listening to Christelle from Water Access Rwanda on how they're getting water to the community, I felt a bit more at peace with that, and I felt like we can achieve at least the first step, the first big step, using those simple infrastructures.
Right.
And the reason I say that is in prevention or in preparedness for outbreak or in refugees' health or in a big urban center, the first things you want is water. And when you take that step, I believe we're going to get to the point where digital health, the way you describe it, can be used to scale up this, what we're talking about now, so the simple things, but at the same time help with the big things, especially around the non-communicable diseases. But in terms of infrastructure, using those simple solutions would be what I would say is our way. It would be the first big step to take.
Yeah.
And I was talking to Patrick, just to add this, I was talking to Patrick earlier, and we talked about knowing the need of where you are.
Yeah.
And definitely in Africa, with the statistics we know we have, we know we have a challenge in sanitation in most places. We have a challenge with water.
Yeah.
And so starting with those would be the first big step.
Absolutely, and in fact, the statistics are damning. I don't know if you mentioned it, but certainly what I saw was that 58% of Africans have no access to basic sanitation facilities. So we have a big challenge, without doubt. I'm going to come back to you about the importance, of course, of talking to us, but I think importantly, talking to the communities, the people who are affected by what we're talking about. I made the government man listen to all of this because he is the one who goes out and practically implements these things. Ibrahima, from your perspective, the practicality of some of these things that they are being talked about here, and also what you are doing as a ministry in terms of innovation to ensure you extend health services to the population.
Merci beaucoup.
First of all, I would like to thank you for having me, for inviting the Minister of Health so that we share what we are doing. Very briefly, I would like to give you an idea of what the city is to have a better understanding of what's going on. Because before I got into health, I was a health specialist. When you have a family, 2 children, 1 wife, each time somebody calls from the village to tell you that somebody is coming over to Dakar, you have to give them accommodation, yet you cannot increase the amount of money spent on upkeep. It means that the city is sitting there, it's growing. There is urban spreading of cities, but the state cannot proportionally follow up on that growth in terms of baseline social services. You know, the city is growing, hospitals cannot keep up with that, transport cannot keep up with us. You know, there are chronic diseases, sometimes diabetes, for instance, but also transmissible diseases that are still out there. Now, solutions. We are suggesting solutions. That's what we are doing. We are changing the paradigm regarding health facility structures. Look at our structures in Africa. Are there real health facility structures? There are a lot of people who are not medical or paramedical staff. We have 56% of staff that provides medical care. 60% are about staff that is providing technical support and administrative support. We are saying that this is as if it's an administrative facility providing health care. We have opened up increasingly houses to promote health. When you do nutrition, fitness, you cook food to help communities understand the various components of health. The Ministry of Health is doing that. The other aspect is e-activities. You said it. You cannot go around it. WHO said that the future of health is digital activities. For instance, a couple of years ago, I was suggested a telemedicine project in the suburban areas in Gejawai to connect a health post to the hospital, 5 kilometers. I was reluctant because I have the health map. My idea is to have teams in remote areas. But a year after, we have seen the result. The gynecologist is saying that, well, he would consult 100 women coming from the health post. Now he's got a tool for consultations. Now he only consults 10% because the sonogram is done from a distance. Only complicated cases are coming over. There are countries that have e-medicine strategies. So the idea is to identify what health requirements and needs require e-technology. We have a e-medicine project. We're going to find out with the Ministry of Health how we can handle it. Teams and priority diseases will be identified, but we will also try to figure out how we can save lives, how we can coordinate medical care. And I think that there's no better option than the digital device
Absolutely. Absolutely. Thank you very much. Is the solution, before I leave you, because we've got about 7 minutes left, is the solution to, yes, technology, we agree, I think it's universal, we agree it needs to be brought in, but is part of the solution actively going to the private sector and saying, come on, tell me what you can do to take away these administrative functions that are adding a huge cost to the burden of caring for the population?
Je pense que la question est fondamentale.
This is of the essence because we have learned that when we talk about digital health, e-health, 80% is about organizational activities, negotiations and discussions. Only 20% represent the technology. You have to talk to people, come up with a consensus, you have to raise funding, you have to prepare health facilities and have the legal framework that is required for e-health. You cannot be successful in health activities without the contribution of the private sector. It's just not going to happen. In Dakar, 73% of facilities are private medical facilities. 73%. So, if you wanted to go digital, it's going to be difficult because the private sector is the private sector. We can put in money in private facilities, but how are we going to deal with the private facility? It would mean that a good chunk of our patients will not be covered because they decide to go to private facilities. So we need to involve the private sector, but we need also to use innovating funding to try and come up with the private sector involved into health activities.
Thank you very much. Thank you very much. So let's talk about how to bring in the private sector. So we are at the solution stage, gentlemen. So now we want those answers. I'm going to move randomly. Whoever is ready to answer can go and shoot. Do you want to go?
Yes, why not?
You have the answers.
The answers. For me, a lot is happening in Africa, and digital health has become this fancy thing that everyone to acquire. Now, digital health, most people want to acquire it, but most do not know what it is. It is just a fancy thing. And in my experience, digital health, if unsolicited, if unplanned, digital health would disrupt the healthcare system in the very bad way. So for me, first, you have to start from a planning perspective. I like the fact that countries like Senegal and 25 other African countries have now come with this digital healthcare strategic plan. You have to start from there, because if you don't know where you're going to be lost in the way. 2, it is about putting in place the legal framework to regulate that. Because we're still finding some countries where you have the national guidelines, and then you have the county guidelines, then you have the village guidelines, and that cannot work with digital healthcare. 3, you have to decide where you want to start from. You can't just, we're still seeing some government official that will go to China, that will go to Singapore, and they will meet with some digital health concepts that they will find fancy and they would like to export to their country. You can't bring ad hoc technology like that. It has to fit within your overall plan. And 4, you have to redesign the healthcare system. The healthcare system, as it is designed right now, is not designed for healthcare. It is designed for sick care. It means you only go to it when you have a disease, but it's not allowing for prevention. It's not allowing for management of chronic care. It is expensive. You still have things like a fee for service. These are barriers to access to healthcare. So you have to redesign it. And I would end up by, we like digital healthcare, but who is going to do digital healthcare if we don't include that in our curriculum in the university, at school? So for me, we have to look at those as solutions.
Education as well. Thank you very much. Elvis?
I think Patrick was spot on. I'm just going to add that in trying to get what we want as a country, as a continent, we just have to make sure that we get everyone engaged, whether it's youth engagement, philanthropic engagement, private sector engagement.
Please
just to think about
engagement, because that's important. It
So-
speaks to something that's very dear to my heart.
Yeah, I did say that because I think you're quite interested in that too. But what I mean is he mentioned legal framework and assessing your own need as a country, as a continent, and leveraging on that, you have a system that the philanthropy can work with more as a kind of incubator. So you have a system, you know your needs, you know where people can actually aid you in research, in rolling out plans, but only then can you then bring people to actually contribute to helping deliver on what you want to deliver on.
Absolutely.
Because it would be really disruptive with no end if the philanthropist or the private sector sets the agenda without being led by the stakeholders, the government, or the people. So for me, it's all about proper engagement of the people by the leadership.
Absolutely, absolutely. And maybe I can mention some names because I see Elvis is a little shy. I can say it out clearly. I am calling out here. We often hear about John Hopkins University, right? In the United States, right? I think Michael Bloomberg, the guy who's running for US president, has also funded some health research in the US. The question we're asking is, where are African billionaires? Where are African philanthropists in funding medical research on the African continent? Is that work perhaps that needs to be done by you, sir, to go and court them? Or is it private sector players who go and do source the funding? Questions that we need to answer. But we've got official answers from the WHO. You are last but not least, sir.
Merci encore. C'est vrai, les fondations font
It's
beaucoup de
true
choses. Nous
that we
savons
need a
votre
lot
promesse,
to build the foundations. At
sont supportés par les
WHO,
fondations.
we are
Mais je reviens
supported
toujours à
by
ma question, le
foundations,
problème aujourd'hui
but
de la santé
the
digitale.
issue of
Any
digital
African
health,
foundations?
est-ce
Non.
qu'il y a des fondations africaines?
Only
Non,
American
non,
and,
juste des fondations américaines et européennes.
Le problème aujourd'hui,
The
au niveau de l'innovation,
issue we face in
l'écosystème
innovation
est là.
now, I mean, we
L'écosystème,
have the ecosystem. The
il est
ecosystem is
Vous
there
avez
and
la
it is
technologie
conducive. You have technology.
Partout, vous avez 3G.
Everywhere you go now, you have 3G, 4G, you have fiber optics. You know, the terminals have seen their costs reduced. For instance, the first mobile phone that was built by Motorola in 1983 cost $2,000 and weighed in 2 pounds in weight. Now you have smartphones costing $10, and the technology is there. Therefore, the need also, the needs are there. Because if mobile banking or e-banking, for instance, has been a success, it's because people are using these technologies. So it's not a problem of people, really. Population need how to use this. Now, why is it not working? The first problem we have is the lack of ambition and vision. As long as our policymakers do not have an ambition that carries a vision, nothing will happen. The ecosystem is there, but there is no ambition, there is no vision. That's the first challenge facing us. The second challenge facing us is that, unfortunately, health professionals are too conservative. They are impervious to change. What they have learned for 20 years, 100 years, 200 years, that's what they keep. They don't want to change. That's the problem we have at WHO. How do we make sure that health professionals accept to use these new tools? That also is a challenge. The third challenge that we have, and that's normal, is that the health sector is the most stringently regulated sector, because we are talking about human lives and we're talking about health. So we are very careful at WHO before we give the green light to any technological solution, because it's a matter of life and death. Technology has made huge progress. You have a lot of connectivity now. You have applications that are not approved by WHO out of caution. That also is a hindrance to innovation. The final issue I'd like to mention is that we need a model that is workable. So we need to find a business model for digital health. We don't have a business model for digital health now. You know, in 1 minute, I can give you a telemedicine solution using WhatsApp, you know, but I do not have a business model for it, because members in the stakeholders in the value chain may sometimes be a hindrance.
Absolutely, absolutely. Thank you very much. Come on, guys, let's give them a hand, because I'm looking at a red screen. It says my time is up, and so I ask you to help me to thank our panelists very much for your time and for your insights, and to thank you for listening throughout all of that. And that's the end of our broadcast. Until next time, thank you. It's time now for the Master of Ceremonies, Mr. Brahima, to take over. Thank you, sir.